County Health and Human Services directors joining us this morning. You guys have been giving us daily briefings here on Good Day. We definitely appreciate it. Let's talk about what Saul mentioned. He talked about those that are being monitored. These, I know you're very closely watching these 75 healthcare workers. The county decided not to issue a state of emergency, not to put them in quarantine. Instead, they had them sign an agreement saying that they would stay home. It hasn't worked in the past. We're basically putting our trust in these people that they're going to do what they're saying that they're going to do, that they're going to stay home. At what point, if you can tell me, does the public safety come before the rights of those being monitored? It's only 21 days. I mean, it's not like we're asking them to stay put for a huge extended period of time.
Well, two things, and I appreciate the county commissioners meeting and discussing this. And from that discussion, two things came out of this. One, if they're signing an agreement stating that they will not be traveling, that's good, because there's a fear factor out here. We're trying to get the individuals in Dallas County and the nation not to have this fear factor and afraid to go out. And so this will help. Secondly, we have our first responders that are working in our various cities that need to know if there's contacts in their area, because if they happen to go buy a house, they need to have the proper PPEs on. So from that discussion yesterday, we were able to get those two things. So I agree, declaration is not needed at this time, but the reality is there's going to be, or there might be, additional positive cases. And so that's going to ramp up the individuals in Dallas County to be fearful of being around people.
Thomas Duncan's family was told to stay put, to stay in their home. We know that they left. We know an order had to be issued to keep them from coming out into the public. We know the second nurse should have not been on a flight.
That's correct.
Should have not been on a flight. She was still on a flight. The fact that these people are just agreeing to do this, I mean, some people are saying, why not just put them somewhere and keep them safe for 21 days, and then this whole thing will be over? Well,
we're in uncharted territory, and people may be concerned about people's civil rights. I think the key point in this is that since we're in uncharted territory, this is my thoughts, that we should basically require everyone, just like we're doing for the Duncan family, to stay in their home and not leave. But again, we will see, hopefully no one will, everybody will obey the order and not leave. So I think that's a key point. We'll see.
Some schools have closed. We talked about this briefly. Some schools have closed to be cleaned. Others are being thoroughly cleaned, aren't closing, but are being thoroughly cleaned because there is at some point either they were somebody, a student there, maybe a staff member was on a flight with that Ebola nurse, or maybe their parent came in contact, a student's parent came in contact with Mr. Duncan, was a healthcare worker. You've got to understand how when parents hear this and they're getting this information from the school districts, that this increases their fear a little bit. I mean, is this just a precaution? Is this necessary?
Well, the direct contacts, definitely, but a contact to a contact, then we're taking it overboard. We should only focus on the direct contacts to Mr. Duncan. Those individuals should be required to stay at home for 21 days, but a contact to a contact, that we're
So you think some of the school districts are going overboard by sending these letters home and saying that they're doing a thorough cleaning because maybe a parent was on the flight?
Right, but the
parent hadn't been at the school.
That's right. But here's the other thing, is that you got to explain this every time we got a case. Now you can see how many health educators have to go out and say, well, you were not in direct contact, so there's no issue.
Right.
So you can see that there's panic, and the best way to reduce the panic is require the close contacts with Mr. Duncan to remain in their house for 21 days.
Both nurses have been sent out of state right now. Does this show that we're not equipped to handle these cases?
I don't think it shows that. I just think that the magnitude of this issue and the uncharted territory, and clearly the missteps early on, demonstrates that the care has to be done in another area, but it also prepares us for what is to come.
Which could be more cases.
Possible.
We'll see. Thank you so much for joining us again. We appreciate it.